So our third plenary speaker today is Dr. Megan Landis, who is an attending staff doctor in the emergency department in the University Health Network Hospital and the University of Toronto's largest downtown teaching hospital. And during the past 5 years has worked clinically in Lesotho, Malawi, and Ethiopia in both emergency medicine and HIV services. She is an associate professor and head of the Division of Emergency Medicine in the Department of Family and Community Medicine at the University of Toronto. She is a founding member and current director of the Global Health Emergency Medicine Center at the University of Toronto. She is a strategic director of the Toronto Addis Ababa Academic Collaboration in Emergency Medicine. Please welcome Dr. Landis to present Significant Gender Gap in Age at Leaving Emergency Medicine, a national Canadian physician cohort. Over to you. Thank you.
Good morning, ISM. So my name is Megan Landis. I'm from the University of Toronto, and I'll be presenting work done by myself and my collaborators, as mentioned, on a significant gender gap in age at leaving emergency medicine, a national Canadian physician cohort. My only disclosure is that I'm paid by the University of Toronto as a clinician investigator and as the division head of emergency medicine. Like much of the world, Canada is not immune to escalating issues of emergency department closures secondary to human resources shortages, in particular after COVID. However, little is known about emergency medicine physician attrition at a national level and about factors that may actually be influencing that attrition. In 2023, this study by Getel et al. In Academic Emergency Medicine really struck a chord in our imagination. It showed not only an early average age of leaving emergency medicine at 50 years in the US, but an almost 10-year differential in age at leaving emergency medicine for male versus female physicians of 53 versus 43 years. This triggered a lot of chatter in our Toronto leadership meetings, where we worried narratively this actually might be true, but how did we find the data? After many weeks of thinking about it, and like all good ideas, this came to me at a 4:30 a.m. shift-induced insomnia moment, that the CMPA might just have this data. The CMPA, or the Canadian Medical Protective Association, is our national single medical legal liability provider in Canada. And there's two important points to understand here. First, in Canada, that 95% of all physicians are members, which totals over 115,000 members across Canada. It's membership-based, not-for-profit. It provides liability protection, legal defense, and risk management education for Canadian physicians. Second, as a member, you must specify your type of work code annually as either exclusive emergency medicine practice, meaning you work only emergency medicine shifts, or by a diversified emergency medicine practice, which means some aspect of family medicine practice with emergency medicine shifts. The third point is that while it's good to have friends at the CMPA who are also interested in interesting questions, they actually have a formal research program in which members can collaborate in asking questions of the membership data. In creating our collaboration, we were able to ask our primary question, which was, is there a gender gap in age at leaving emergency medicine in Canada? And in addition, we were also interested in annual trends among physicians leaving emergency medicine practice, both pre and post-COVID, and in other characteristics that may be related to emergency medicine attrition. We extracted data from 2017 to 2023 from the database. The inclusion criteria were physicians with an exclusive or diversified emergency medicine code. We excluded physicians leaving for reasons other than retiring or changing their practice, so if they left the country or they had died. I draw your attention to the definition that we'll be using, which is leaving emergency medicine practice means either retiring or changing your practice to a non-EM-based practice. We use descriptive statistics to look at demographic characteristics, annual rates of leaving emergency medicine practice, and median age at leaving emergency medicine practice, both by gender, and associations between leaving emergency medicine practice, age, gender, practice setting, and medical legal case history. Overall, 16,195 physicians were working in emergency medicine during that time period. 321 of them were excluded for the reasons as mentioned above. There are some nuances in this table that are interesting, but we'll just highlight 4 things for you today. The first is that just under half were in exclusive emergency medicine practice versus diversified practice. Secondly, that 61% of the cohort were male versus 39% female. Overall, and when stratified, age distributions certainly skew to younger ages in practice. We also examined whether practice setting and medical legal case history were important factors related to emergency medicine attrition. Give me 1 second. And you can see that the majority of physicians were either practicing in a large city and had 0 cases. Over the 5-year study period, 20% of the total cohort left emergency medicine. Of those, 11% retired fully, and 89% changed to a non-emergency medicine practice. Where they went to varied in terms of non-emergency medicine practice, with the majority of the physicians transitioning in both exclusive and diversified emergency medicine practice to a general or family practice code. We first looked at annual rates of leaving emergency medicine practice over the years in the study. You can see on the left-hand side, the y-axis is the total number of emergency medicine physicians in the workforce, as represented annually by the bars, which you can see increased over time. The proportionate growth among women in the cohort was 30%, and among men was 16%, leading to an increasing proportion of women over time in the cohort. The line at the bottom represents annual attrition, which ranged from 3.2% to 5% annually. And it's in fact a stratified line for men and women, which are almost completely overlaid. Of note, we were curious about an effect of COVID on attrition, and in fact, the line remains relatively steady throughout the period, and post-COVID rates appear to mirror pre-COVID rates. When looking at age at leaving emergency medicine practice, we find a relatively young age of emergency medicine attrition overall at 49 years, quite comparable to our American colleagues, along with a 10-year difference in age at leaving emergency medicine practice for male versus female physicians of 53 versus 43 years, respectively. For those indicating when they left that they were fully retiring from medicine, their average age was higher at 68 years. But as we mentioned above, the vast majority of physicians that left emergency medicine practice actually changed their practice. And the age of changing practice in this subset is 46 years, with an 8-year difference still between male and female physicians. We ran 2 adjusted models for the risk of leaving exclusive emergency medicine practice and one for diversified emergency medicine practice. Factors significantly associated with leaving exclusive emergency medicine practice include being female, age over 50 years, working in a rural practice, or having 5 or more medical legal cases in the 5 years prior to leaving. Factors associated with leaving a diversified emergency medicine practice include, again, being female, age less than 35 or greater than 65, and here we see working in a rural practice or a small setting was actually protective compared to our working in a large city, and medical legal case history was not significant in this model. Looking further at the data and at findings from the US, which have shown higher emergency medicine attrition rates within the first 5 years of starting practice, we find that 1/3 of all the physicians leaving emergency medicine practice did so in the first 5 years, and a higher proportion of female physicians left relative to male physicians in this early period. We identify several limitations. It is possible that people that appeared to leave in the later part of the study and then thus came back to practice may have been misclassified. We did extend the study period for 10 months to interrogate the data to see if this would have an effect, and found only a very small number of physicians that this happened to. There may be additional variables that are not in this data set, which could explain the attrition and the gender gap that we've identified. We have in this data set no data on actual hours worked or shifts worked. And I think most of interest, we're unable to describe any reasons why physicians are leaving emergency medicine. In conclusion, this is the first study of gender-stratified emergency medicine attrition in Canada over the pre- and post-COVID periods. We find that attrition rates did not increase post-COVID, that the average age of leaving emergency medicine overall is 49 years, and a third of those leaving emergency medicine do so in the first 5 years of practice. We also find that there's an important gender gap in emergency medicine attrition. So female physicians were at a higher risk of leaving emergency medicine practice and left on average 10 years earlier than men. Importantly, we went looking for a gender gap based on what we saw in the US literature, and we can say today that this sure looks like it's not unique to the US. I find it striking that our data almost completely mirrors the US experience, and we speculate that this may not be limited to Canada and the US alone. I think the question for all of us is, what do we do with this data? How do we support all emergency medicine physicians in their careers and encourage retention? And I think for this, we need to understand why physicians are leaving, in particular women, and this is the obvious next step. Thanks very much, and I'm happy to take any questions.
John Dreyer, Western University, London, Ontario. Thank you. That was a wonderful presentation and great work. Just a question, did you look at, did you try excluding all the people who left within the first 5 years and see how the data changed? Because one would wonder whether or not people chose the wrong specialty, or they just had a terrible experience in those first 5 years. I just kind of wonder if, in fact, the average age of sort of staying in the specialty, or the length of time, might be somewhat different if you excluded those folks.
I love that you asked that question. I have a graph for you. We actually did exclude all those physicians that left, and the ages are still relatively young. So you can see that the average age of leaving was still 55, and there was, for men, it was 58, and for women, it was 49. So we still see the differential. Thanks for asking that question.
We've got time for one more, or
Yep,
suggestion?
thank you for the wonderful presentation. It was necessary and well done. From my own experience, have you thought about looking, because over the last 20 years, particularly in large cities and large programs like residency programs, it's become sort of less encouraging to blend a practice of both emergency medicine and family medicine as used to be way back in the past. And I'm wondering, and I know from my own personal experience, that I think it was a protective factor for me in my early career, particularly during my childbearing years and when my children were younger as a woman, to have both family medicine and emergency medicine as part of my practice. And then as time went on and my kids got older, I then transitioned to full-time emergency medicine. So I'm wondering if that's something that you've thought of, or you thought about looking, and perhaps looking at maybe some of those factors, as given the age you're seeing, particularly with women, if childbearing and the raising young children could be part of this issue that you're finding and seeing.
Yeah, thanks, Dr. Solomon, for that question. There are all kinds of very interesting nuances in terms of the way that the workforce shifts between diversified and exclusive practice. We will be including some of that in the full paper. Just for the purposes of this presentation, we limit it to what we presented. But I think it's an important point. Thanks. Great. Oh, last question.
Suggestion. Closer? Oh, there we go. Not so much a question, but more a suggestion. There is something that happens to women around about their late 40s that is a temporary condition which does affect perhaps your ability to take on some of the hours and the shifts and deal with the stresses of emergency medicine. Just putting it out there.
I love that you put that out there, because the next step that we're looking at is actually doing a qualitative survey looking at why people are leaving. And I think there's some really big questions that we have to ask around change in life, responsibilities, caregiving, hormonal changes, all of those things. I think there's a lot of work to be done here to understand what's going on.